I met Mr. Poole probably about 2.5 years ago when he came to the hospital and he was prescribed oral medications for his Parkinson's disease. We trialled him on the Duadopa, and instead of being restricted in a chair, he was able to walk around the unit freely. He came to the hospital with a carer and he left the hospital by himself.
We were living in one room, 3 meals a day, about 12 hours a day, just sleeping in bed.
We had to provide something in our local environment, and Duadopa is a technology which doesn't require the complex infrastructure of a large urban teaching hospital, and which we can develop in a hospital such as this, where we have got good gastroenterology colleagues and technology.
Mr. Poole was first known to me about 2 years ago when the neurologist asked me to see him with a view to placing this tube, and at that time this was a new procedure in Townsville Hospital. We hadn't really done very many cases at all.
Parkinson's disease is a condition for which there are, fortunately for neurologists, a lot of options, but it does get challenging as years pass.
We make an incision on the abdominal wall and then we guide the Duadopa feeding tube through the abdominal wall with the scope. We then have to guide a further tube down into the lower part of the intestine so that the Duadopa can get there without being processed by the stomach juices. So it didn't take Dr. White much to persuade me to get involved in this particular project, particularly when you see the very gratifying outcome that patients achieve very quickly after the procedure.
And Mr. Poole's had a delightful response, and it's had a fantastic effect on his mobility and quality of life.
I'll be going back to the motel and flying home tomorrow.